Hi, and welcome to another live Google Hangout. I'm Dr. Jay Harness, Medical Director of Breast Cancer Answers. And today we really have an important and sensitive subject to discuss, the subject of emotionally supporting those who are newly diagnosed with breast cancer, as well as obviously supporting them through their journey of treatment and survivorship and all of those aspects of overall breast cancer care. Now, I need to share, before I introduce our wonderful guest today, I need to share with all of you sort of the backstory of how I'm so fortunate to have Dr. Mark Howard join us today. I'm a guy who does workshops, and I had the real privilege last November, mid-November of last year, of doing a workshop with Dr. Mark Howard and his really dear friend, Michael Neal. And this was a workshop on tapping into the internal wisdom that exists in all of us. And during the workshop, Mark and I started chatting, and I shared with him our Breast Cancer Answers website, and he looked at me and said, "Well, you know, Jay, my wife has had breast cancer." I said, "Really? Tell me more." And Mark told me the wonderful story about his wife and her diagnosis and the excellent treatment that she received up in the Bay Area. And I thought to myself, you know, here's a guy who's got 30 years of experience as a PhD psychologist. He is also the spouse of a breast cancer patient. This has got to be something that we ought to share with our general audience here at Breast Cancer Answers. So Dr. Mark Howard, welcome to a live Google Hangout.
Well, thank you, Dr. Harness. That was a nice introduction.
Yeah, and please call me Jay. You know, Mark, it's really interesting. Whenever I meet patients, I always walk in and literally introduce myself as Jay. I figured that my mother didn't name me doctor when I was born. I had to earn it, but I still always,
great.
Making that sort of personal contact. Well, Mark, you've been through obviously a galaxy of experiences with your lovely wife. Why don't we start off with, what was the reaction? Were you with your wife when she found out that she was being diagnosed with breast cancer?
Yes, you know, actually, I went with her. I was in the waiting room when she had the biopsy. So yeah, you know, she was referred to a surgeon who did just an outpatient biopsy just to get some of the tumor and see what was going on there. So I was in the waiting room. I wasn't with her while they were doing the biopsy, but I was there for her, you know, through that day.
Yeah, so there's obviously, and this is a really good point. I'm really glad you brought this up because we're now at the biopsy stage. You know, generally women, when they've had their imaging studies or they've felt a lump in their breast and they go to the doctor, oh, gee, we need a mammogram, or oh, gee, we need an ultrasound, and oh, gee, we need a biopsy, that creates a lot of anxiety in patients. How was your wife dealing with just even the anxiety of the biopsy? And frankly, how were you supporting her through that?
Well, you know, I really do think she had a lot of anxiety about it and was fearful. And you know, what I shared at that workshop, what allowed me to support her was that, you know, I just know that there's an inner wisdom we all have that, you know, is the intelligence of this universe that creates the universe, and it can assist us. So that was always kind of in the background for me to refer to, look within myself for that. But it was the connection of that to my wife, you know, and I think I always went back to love and understanding. And although I was anxious too, I knew that if I could stay within the foundation of love and understanding, you know, providing her comfort, understanding that she's in kind of an anxious state of mind, and be there for her as much as I can, I think that's at that part of the whole time with this breast cancer treatment and so forth. That's what I always came back to try to get my bearings to be of help to her.
Okay, so that's a really, really important teaching point to our audience. You know that your significant other, your spouse, your friend, your family member is anxious. So if you can sort of remain grounded yourself and simply be present, not try and solve the problem, but simply be present, that's major support. Is that a fair summary?
Yes, I think it is. I think one of the things in psychology is that, is we can recognize that when people are, people are anxious or fearful, they're in troubled states of mind. And I think in a love relationship, one of the roles of the partner is to be of service to the other person's state of mind. So it is, of course, being present, but it's also about giving her the understanding that she needs me to be, not be so focused on how I want her to be, but to be focused on taking care of her state of mind. Kind of like bringing chicken soup to somebody who has the flu. It's kind of that idea. And having that understanding, coming back to it as much as I can, that role to be of service to her during a very fearful time.
Okay. Well, that's a lovely, lovely summary of how we should approach this. So, Mark, you were there for your wife's biopsy. Was it like 3 or 4 days later when you all found out the diagnosis?
Yes, so it kind of went to where, it was shown to be cancerous, and malignant. So then, yeah, we were together in hearing that, and then she went to meet with the surgeon and her personal physician on her own to, decide what to do with this. And we again met with another surgeon. We had two surgeons that we met with, and I went with her to the second meeting. And I think that's really important as a partner or caregiver, to be there as much as you can when your partner's talking to her physicians, because they're so nervous and fearful already. They can't hear everything. So I thought it was very important to be with her through that. So yeah, I was with her when we went to the second opinion, and in terms of her making her own decision about what treatment to take.
Yeah, I really want to reiterate this point. And quite frankly, Mark, what I do in my practice, I insist that somebody else be there because it's exactly what you said. People are feeling overwhelmed. I often talk about this as the deer in the headlights phenomena. You're frozen emotionally, physically. You're frozen, and you can barely take in 10 or 15% of what professionals are sharing with newly diagnosed patients. And the good news is, in my line of work, that we have multiple options for patients. And so, quite honestly, it takes me usually 2 to 3 visits at least to work our way through the options that the patient has. If she needs additional imaging studies, such as a breast MRI, we do those things. But it's really important that a minimum of one other person be there. But if other family members want to come along, because invariably what happens is you're walking out to the parking structure at the healthcare center, you say, "Now what did he say again?" And so having another pair of ears and brain and all of that there is really important. So, well, I'm assuming your wife was offered some options. Is that a fair summary?
Yes, she was, again, I really support the way that you go about it. I think that's so important to have a support person, with your patient. But yeah, my wife was offered some options, and yes, she was. So, we talked through that together.
Okay.
And yes, and with the physicians.
And then, Mark, in this day and age, we have so many people going on the internet now looking for additional information. Tell us a little bit more about the process you and your wife went through, or what your wife went through from what you know, about how she was making her decisions. Did her fear and anxiety improve by your support? Share with us a little bit more of the dynamics of what was going on.
Well, I think that it was not an easy time for her, and I think that it was really about her making a decision about her own survival, the survival of this and what would work best for her. And but she felt confident about the treatment decision she made. And through that process, it was a very frightening process for her. So she went through a lot. Now, in those days, this was like, I believe, 1996. So there wasn't that much of searching in the internet at that point. It wasn't that sophisticated. Now, I think sometimes those searches can even increase anxiety,
Right.
I mean, there's knowledge out there, but, I mean, it could get people even thinking more about it. So what I was really trying to help her do was try to maintain her calm and stability. Know that that within people there's a source of resiliency. There's a wisdom that she needs to find for herself. That, and I wanted her to know that I was there to support any decisions she made on the treatment process.
Right.
She had to follow her own wisdom about that.
Boy, that's really an interesting point. I'm interested in your feedback to me now, when talking about how to tap in with this internal wisdom that we have. Often I'll get down to, let me just give you a basic example, lumpectomy versus mastectomy. And everything, Mark, in my line of work that we do has advantages and disadvantages. There's no perfect solution. And occasionally I'll run into situations with patients where they say, I just can't make up my mind. And so one of the tricks that I've learned through the year, I said, okay, I want you 3 times a day to immediately write down, without thinking about it, I want, and then fill in the blank. Mastectomy, lumpectomy as an example. Another trick I've heard from colleagues of yours is actually, if you're right-handed, writing the answer down with your left hand, in other words, to tap into that other side of the brain, if you will. Listening to you, and I really enjoyed the workshop that I did with you, it sounds like that little method that I'm using is assisting people to tap into that internal wisdom. Does that sound fair to you?
Yeah, I think that this wisdom or the intelligence we're a part of is more available than we realize. And I think one of the pieces around an exercise like you give people is that it helps them kind of clear their minds of extraneous thoughts, And the more you can settle your mind down around all the thinking that goes around an issue like this, you're more likely to hear what feels right to you, that sense of wisdom that I talk to my clients about. It just feels right to you. All of a sudden it just seems to appear. So these exercises are ways that people, lose, it just allows them to clear out a lot of other thoughts and just maintain one focus. But
Mark, what do you share with your clients as practical ways of doing exactly what you're describing? I've shared my little method, but you're dealing with clients, probably many of whom are in crisis for one reason or another. How do you teach them how to tap into that internal wisdom?
Well, it's really an understanding that takes place, and I talk to people really about they're getting really a sense that's there in the first place. In our communities, in our culture, we have really developed our intellect quite a bit, in terms of all this technology we're creating, and we kind of left behind this sense of ourselves that we do have an intelligence and wisdom that goes beyond our own intelligence. So I talk to people about being quiet. I talk to them about how to be reflective, like they would be listening to music, and how they don't really have a lot of thinking going on in their minds when they're listening that way. I try to help them identify with certain life things they do already where their mind is quieter. So a lot of people find that when they, do some exercise or they're gardening, and I try to help them identify that state of mind and help them transfer that where they can do that anywhere. They can sit down and kind of get into a gardening state of mind. The other piece is really to help people, who are in anxiety and depression, which is a lot of the clients that I see, help them kind of turn down the volume of that thinking so this wisdom can kind of appear for them. I kind of use the idea of, they've let the gremlins, that movie, The Gremlins, they let the gremlins come in and rent space in their minds, and they've got to begin to, send them out the door and kind of, make some room now for this beautiful gift we're given, this connection to the intelligence in our universe, this spiritual energy.
Well, that's interesting. Any other practical ways of doing? Does meditation work, Mark, or other? Another way I've heard of doing this is called mindful walking, as an example, where you're out walking and you're mindful of the beauty of the environment around you. Any other practical ways that we can share with our audience of really tapping into this internal wisdom? I agree with you. I think we clearly all have it.
Well, Jay, I think all of those things are out in our consciousness because they do help people. Yoga, meditation, mindful walking, all of that works. In my practice, what I have seen, what I help people find with all of those ways to find a quietness is that they have to find one of those ways that really fits them. Because somebody who's in a situation where there's an adversity, like, a diagnosis of cancer, has to find their own way to use some of those methods, because sometimes it's hard for people to put in a method like meditation. That might be foreign to them, not easy to do. So I try to help them take a look at all of that and see which one really, really seems to be right that comes from a deeper source than rather it being a good idea to meditate right now. I'll just give you a quick story about what I mean by this. In the throes of this, my wife was talking with my stepmother. My stepmother had lost her 3 sons through, their deaths early in life. And my wife was just talking with her about, well, how do you cope with that? How do you live with your sons having died? And she said to my wife, you just have to live your life. You just have to do it. So there's a mechanism, right? There's a coping mechanism. But it resonated deeply with my wife. She heard something there that she could use. And she could take something from that and apply it for herself. And she would always come back to, just live my life, just do it. I've got to, go for the surgery. I've got to go for the treatment. Just do it. So what I mean by that story is all of these ways that help people get quiet: meditation, yoga, quiet walks, reflect, sittings, reading a spiritual book, have to resonate at that level that it resonated with my wife. And I help my clients find that. And sometimes they'll try some approaches that don't really work for them. So we'll just keep at it until something really resonates for them. Does that make sense?
Oh, it certainly does, Mark. In other words, we've got that intuition within ourselves. We've got that wisdom, and who knows what it is. I find the brain and our souls and our bodies just so fascinating, because even though we're in a quiet state, our CPU, if you will, is still out there sort of searching, and all of a sudden, bingo, it's like the story you told about your stepmother. That really resonated with your wife and was one of the real keys of helping her get through her journey.
Yes.
And it sounds like the journey went pretty well, because if that's 1996, we're now in 2015, so she's out there about 19 years now, and sounds like she's really done well.
I think that one of the things here that's so important is that I looked at it in terms of an idea around stages, and support needed at each transition stage. So there's the biopsy, there's the treatment, there's the meeting with the oncologist, there's the decision for ongoing treatment. Then there's the after effects, the effect of that treatment on her body. You know, even she went on this. I don't know if they still use it now, but they went on the 5-year tamoxifen use. You know,
Yeah. Oh,
which
yes. No, it's still there, Mark.
yeah.
Absolutely, and
So
even a
then
newer form of it is there. You
yeah.
bet.
So then there's adjustment to what that does for a human body, right?
Yep.
Even though it produces remission and even cure at times, right? And protects the person from a recurrence. So it went well for her, and I think we were just blessed with that. And yet all the way through, you know, it was about being there and seeing that, trying to hear her state of mind, because, you know, still she goes for mammograms, and that's still an anxious time. It's still in the memory, and it comes up for her. So again, being aware of just how it may not look as an anxiety producing time now in my mind, because I'm saying, here you are all, you know, I could say, here you are all these years, why are you still anxious about it? You know, I've learned not to come from there, because it's more about her and how she views it, and what a history of cancer has impact, even if people are in a solid remission. So I look at it as stages that is helpful for the partner and support person to be there, you know, with as much support as you can get through each one of those stages,
Yeah.
including now, you know, Jay, after she's through with tamoxifen and all, it's still there being supportive of her, even when she goes for mammograms. I'll tell you another story here, you know. I would, even though it reminded her of the cancer treatment, what dawned on me was to each year, when the anniversary came, to give her a gift, and wow, it touches me now. You know, to just give her a loving gift, and for her, she appreciated this, you know, even though, you know, it brings to mind, oh man, I had the cancer diagnosis, but the gift of celebrating a year, 2 years, 3 years, was a helpful thing to, again, bring it back that
Wow. Well, Mark, what absolutely beautiful advice. This has just been a spectacular session with you. You are a man of great empathy, and wow, I'm just blown away by this hangout today. Any final thoughts you have before we wrap up?
Well, Jay, you know, my thoughts are really about you and what this whole video program provides people. Your heart is in such a good place, and I just loved how much caring you have for your patients. And I think that the only other piece I would say is that, you know, you just take it day by day. You like take my stepmother's advice, which is just live your day, and be easy on yourself, no matter what you're in. Whether you're in a lot of fear today, whether you're in some peace of mind, go easy with yourself, and know that you've got the intelligence of life behind you, available to you, and listen for that.
Well, Mark Howard, Dr. Mark Howard, on behalf of Breast Cancer Answers, I want to thank you from my heart to your heart for being with us today. I want to also tell our audience that I think in a few weeks we're going to have Dr. Howard back, and we're going to be talking about how the caregivers can support themselves going through this journey with their significant person in their life. So on behalf of Breast Cancer Answers, it's been my honor and privilege to share this time with you. Have a beautiful day. We look forward to joining you again in the near future. Goodbye for now.